Today we'll be learning about circle of willis. Why we have the name circle? Because it forms a shape like circle. The picture of a circle of willis looks like this. Now, as we can see that we have anterior spinal arteries, we have vertebral arteries, medullary branches, posterior spinal arteries, posterior inferior cerebral artery, also known as pica. We have basilar arteries, we have anterior inferior cerebral artery, known as ica. We have labyrinthine arteries, we have pontine branches, we have a superior cerebral artery, we have a posterior cerebral artery, we have a posterior parietal artery, and we have internal carotid artery, posterior communicating artery, middle cerebral artery, anterior communicating artery, and anterior cerebral artery. Now all of these might seem confusing because there are a lot of names, and basically what are they? Is that they are the blood vessels which supply the part of the brain. The part of the brain which they supply, so they get the name. So like if they supply the cerebrum, it will become cerebral artery. If they supply cerebellum, it will become cerebellar artery. So now we will break this into chunks and see how we can form this circle. Circle of willis. It can be categorized into two sections. Basically, the circle of willis arises from vertebral arteries, and the second part which the circle of willis arises from, it is from internal carotid artery. Now this vertebral artery, it forms vertebro-basilar system, and this internal carotid artery, it forms carotid system. So where can we begin this circle of willis? We can begin this circle of willis from the heart. As we can see in this diagram over here, is that from the left part of the heart, from the left ventricle, we have this aorta. So this aorta comes and we have the arch of aorta. This arch of aorta gives up a branch known as brachiocephalic artery, and this brachiocephalic artery then gives branches again. We have right subclavian artery and we have right common carotid artery. Then as we move on, we can see left common carotid artery over here, and as we move on, then we can see left subclavian artery over here. Now one thing to note here is that the right subclavian artery and the left subclavian artery, they give vertebral arteries. So the right subclavian artery will give you right vertebral arteries, and the left subclavian artery will give you the left vertebral arteries. We are done with vertebral arteries. So the question is, where do we get internal carotid arteries? We get internal carotid arteries from here, which is the right common carotid artery and left common carotid artery. So this right common carotid artery will again give two branches. There will be internal carotid artery and external carotid artery. And same with the left common carotid artery. The left common carotid artery will give you the internal carotid artery, which is for the left one, and the external carotid artery, which is also for the left one. Why for the left one? Because they come out from this left common carotid artery. So now we know where do we get vertebral artery and carotid artery from. Let's move on and see how do we get this vertebro-basilar system and this carotid system which make up the circle of willis. So now we are at the vertebro-basilar system, and we know that the vertebro-basilar system, they will arise from the vertebral arteries, and vertebral arteries, they arise from the subclavian arteries. So what happens is that these vertebral arteries, they go through a foramen, or like they go through a hole. That hole is found on the transverse process of the cervical vertebrae. So vertebral artery goes through that hole, and that hole is known as the foramen of the transverse process of cervical vertebrae. Then from the cervical vertebrae, it will go into the foramen magnum. Foramen magnum, like it is the opening of the skull. Now one thing to know here is that we have three layers, protective layers, like we have via meata, we have arachnoid meta and we have dura meta. We know that dura meta is the outside layer. And we also have the subarachnoid space. That subarachnoid space is where we have the cerebrospinal fluid or the CSF. So these vertebral arteries and also the carotid arteries. So both of these vertebral and carotid arteries, they are in the subarachnoid space. So it means that they are floating in the cerebrospinal fluid. Then from there, they give on the branches which will be seen here. Here we have this orange color, it is the spinal cord. And this pink color, it is the medulla. This green one above the medulla, it is the pons. And above the pons, the purple one, it is the midbrain. Now between this pons and medulla, between this green and pink, we call that as pontomedullary junction. Then as we can see that here, this blue one, it is the cerebellum. And we can see that with the cerebellum, and this one is the inferior part of the cerebellum. So this vertebral artery goes, and we can see that there are two vertebral arteries, the right and left. The right and left are going here, and as you can see, as they are entering the medulla, they are coming together. So this right and left, they will come together, and then they will become one. When right and left come together, they form one artery, and now that artery is known as basilar artery. So as we can see, it is written here, basilar artery. Before it was vertebral arteries, now it is basilar artery. And this basilar artery, it will go on top up till the midbrain. And in the midbrain, it will give posterior cerebral artery. And this posterior cerebral artery, as we know, that from the name we can know which part of the brain this supplies the blood. So posterior means back, behind. Cerebral means cerebrum. Artery, it is supplying the blood, artery. So this posterior cerebral artery, it is supplying the behind part of the cerebrum. Not only the cerebrum, as we can see, this posterior cerebral artery, it goes around the midbrain. So because it is going around the midbrain, it will also supply a part of the midbrain. So this posterior cerebral artery will supply the cerebrum, the back part of the cerebrum, posterior part, and also the midbrain. Now coming back to the vertebral arteries. So we can see that vertebral artery is here, and then here the vertebral artery, it will give one branch. It will give one branch, and that branch will go like this around here. We know that this blue part, it is the cerebellum. So the artery which will supply the cerebellum, so we will have the name cerebella somewhere. So we know that we have cerebellum here, so cerebella will be the name here. This is the name of the artery, posterior inferior cerebral artery. So where does it supply? We can know it from the name. Posterior means back, behind. Inferior means down. Cerebella, it is supplying the cerebellum. So this artery, it is supplying the back part and the down part of the cerebellum. Thus the name posterior inferior cerebral artery. So this posterior inferior cerebral artery, it is on both sides. On the left side, on the right side. Why on both sides? Because we know that we have two vertebral arteries, right and left. So the right one will give one branch, and the left one will give another branch, which will supply the cerebellum. Now also this vertebral artery, it will give another branch, but it will go down. And we know what is down. Below the medulla, we have the spinal cord. So these two branches, these vertebral branches, they will come down to it. So we know it is supplying the spinal cord. So the name of this artery is anterior spinal artery. Anterior means front. So this artery, it is supplying the anterior part of the spinal cord. So now that we know that the blood is supplying at the front part of the spinal cord, but blood should also be supplied at the back part of the spinal cord. So the back part, it is known as posterior. So we must have posterior spinal artery. So we can see here that we also have posterior spinal artery. This spinal artery also comes from vertebral arteries. So from the vertebral arteries, we have anterior spinal artery and we have posterior spinal artery. But the difference here is that we have only one anterior spinal artery, only one, which is supplying the front. But at the back part, we have two. So we have two posterior spinal arteries. Now let's see what branches the vertebral artery has given us. In the vertebral artery, we have the anterior spinal artery, we have the posterior spinal artery, and we have the posterior inferior cerebral artery, which is supplying the cerebellum. And as this vertebral artery, they come together at the pontomedullary junction, then they will give a branch. When they come together, then they form the basilar artery. Then this basilar artery, it will give a branch, and this branch is going down over here. It is in the blue color. So when it is in the blue color, we know that blue color is the cerebellum. So in the name of the artery, cerebella must be there. So this artery, anterior inferior cerebral artery, also known as AICA in short term. And this basilar artery, it gives on both sides, on the left side and on the right side. So this basilar artery, it gives of an artery, and anterior means front, inferior means down, cerebral artery. And what did vertebral artery give? Vertebral artery gave the posterior inferior cerebral artery. And this basilar artery, it gave anterior inferior cerebral artery. So the only difference in the name here is that we have anterior from the basilar artery, but for the vertebral artery, we have the posterior. And both of them, inferior cerebral artery, they are the same. So it means that both of these blood vessels, they are supplying the down part of the cerebrum. But the only difference is that vertebral artery, it is supplying the back part, and this basilar artery, it is supplying the front part. But both of them are supplying the down part of the cerebellum. Now we enter into the green zone. This green zone, it is known as pons. And here at the green zone, this basilar artery, it gives a branch. And the name of this branch is labyrinthine artery. This labyrinthine artery, it goes with cranial nerve 8. This labyrinthine artery goes with cranial nerve 8 through the internal acoustic meatus. Like there is a hole. So from that hole, this artery and cranial nerve 8 will go. And this artery will supply the inner ear. That ear, it has three parts. We have the outer ear, we have the middle ear, and we have the inner ear. So this labyrinthine artery will supply the inner ear. As we move up, we have these pontine branches. Why pontine branches? Because they fall in the pons category. They are in the pons here. And so this will supply the pons. So from the name pontine, we have pons here. And as we move here, this basilar artery then gives the artery here, which is posterior cerebral artery. We have discussed posterior cerebral artery before. So to recap, we have this vertebral artery, right and left. And at the medulla, they start to come together, and at pontomedullary junction, they become one. And when they become one, they have a name as basilar artery. This basilar artery will go on top here up till the midbrain. In the midbrain, it will give the branch, which is known as posterior cerebral artery. Also, if we come down again, we have this vertebral artery. It gives a branch which is supplying the spinal cord, the anterior part of the spinal cord, which is known as the anterior spinal artery. There is a branch to the posterior part of the spinal cord, which is supplying, so it is the posterior spinal artery. We have one anterior spinal artery and two posterior spinal arteries. This vertebral artery also gives branch known as posterior inferior cerebral artery, and this basilar artery, it gives a branch which is anterior inferior cerebral artery. And then as we move up in the pons category, we have labyrinthine artery and we have pontine branches. And then over here, this also gives this basilar artery, it gives superior cerebral artery. So from the name, superior means on top, cerebella, cerebellum. So this one, it will supply the cerebellum, the top part of the cerebellum. So this is the vertebro-basilar system. Let's move on to the carotid system. We were done with the one part of the circulus, which was the vertebro-basilar system. Now let's move on to the second part of the circulus, which is the carotid system. Now, as we know that this carotid system, it begins from the internal carotid artery. An internal carotid artery, it begins from the common carotid artery. So this internal carotid artery, it is going up, and now it has to enter inside the brain, or inside the skull. So how does it enter? It enters through a canal. So here it is a hole. So we call this hole the carotid canal. So this internal carotid artery goes up, but it does not go on the other side completely from that part. This artery, it will go through the carotid canal, and then it will turn. It will turn, and then it will go. Why it does not go directly? It's because it has an opening on one side, but on the other side there is no opening. So this artery will have to turn. So when it will turn and it will go up, then there will be one hole, and the opening on which the other side of the part where this opening is, it is known as foramen lacerum. So this internal carotid artery, it enters through carotid canal, it goes in, it turns, and then it moves out through this foramen lacerum. So when it goes out of the foramen lacerum, then this carotid artery, internal carotid artery, it will go inside the cavernous sinus. This internal carotid artery, it will give a branch, and this branch, it will go here towards the eyes. So this branch is known as ophthalmic artery. And as this ophthalmic artery is going, we see one hole here, and we see another thing here, the cecal and the triangle. This one, the cecal, from where it goes, it is known as orbit, and then it goes inside and it gives some branches. Like, we are not interested in these branches here, like they will go, but the main branch to discuss here, it is the central retinal artery. So we have ophthalmic artery going through the hole, and then we have another branch which is central retinal artery. From the name we know retinal, it supplies the retina of the eyes. Central carotid artery coming, branch, ophthalmic artery, another branch, central retinal artery. So now this, after giving the branch to the ophthalmic artery, this internal carotid artery, it is moving upwards. It is moving upwards, and then it gives another branch. It is the anterior choroidal artery. Why the name choroid? Because it is supplying the choroid plexus of the lateral ventricle. It is supplying the choroid plexus of the lateral ventricle. Then this internal carotid artery, it will go further. It will go further and it will give one branch. This branch is the middle cerebral artery. So from the name middle cerebral artery, we know that it is supplying the middle part of the cerebrum. So this artery, the branch here. And then as we move on, we have another branch which is the anterior cerebral artery. This anterior cerebral artery, so which part it supplies? From the name we can know. Anterior, front part. Cerebral, cerebrum. So this artery is supplying the front part of the cerebrum. So it has the name anterior cerebral artery. Now we can see that over the anterior choroidal artery we have the pituitary gland, and we know that what is above the pituitary, we have the hypothalamus. Now the main thing to know here, which makes up the circle of willis, is this black one. We can see here that there is something linking these two arteries, these two sections. Now in order to prevent confusion, whatever it is here, the anterior cerebral artery and the middle cerebral artery, the same thing is here on top. The same thing we have here. This is the middle cerebral artery. This one is also the middle cerebral artery. This one is anterior cerebral artery, and same thing here. So now these two, they need to be connected together. These two, they need to be connected, and what connects them, it is this anterior communicating artery. Now when these two are connected, now we need to connect the carotid system and the vertebrobasilar system. How do we connect them? What connects them is this here, the black one. This is the posterior communicating branch. So the vertebrobacillar system is connected with the carotid system by this posterior communicating branch. So there are two posterior communicating branch, one over here and one over here. Why we have two? Because we have this two, like we can say we have like duplicates. We have anterior cerebral artery here and anterior cerebral artery here. They are connected with the anterior communicating artery, and so both of them, they will give the branches, which is posterior communicating branch, and both of them will come and then they will join with this one, posterior cerebral artery. So now what we can see is that like they are forming a circle, something like a circle. And you know what we were studying? We were studying the circle of Willis. So now we can see here that inside the brain we can see something like a circle. So this is the circle of Willis. They bring that picture again in the which we brought in the first place. Here, this is the circle of Willis. Now the difference between the previous one and this one is that the previous one, you know, which was showing the internal carotid artery and the ophthalmic artery, retinal artery, that one was the side view. We were watching those arteries from the side view, like we were standing on the side and we are looking at the side of the head. So we have vertebral artery here. So vertebral artery, we know vertebrobacillar system. Two vertebral arteries coming, they come here, they join, they form a bacillar artery. So bacillar artery going on top, giving a branch, posterior cerebral artery. Now vertebral artery, we know that it gave a branch which was the posterior inferior cerebral artery, and also it gave a branch which was anterior spinal artery. We also know that spinal cord, it also needs blood supply on the posterior side. We have two posterior spinal arteries. These two posterior spinal arteries also came from these vertebral arteries. Now also we have medullary branches here, which are supplying the medulla. I did not mention the medullary branches in the beginning, but these medullary branches are there. When these two vertebral arteries, they come together, they form the bacillar artery, and as we go on top, this bacillar artery gives a branch, which is anterior inferior cerebral artery, which is supplying the cerebellum. So as we move up, we have this labyrinthine artery. Labyrinthine artery is supplying the inner ear, the internal ear. So as we move up, on the pons we have these pontine branches, and as we move on further on up, we have the superior cerebral artery. All of this, they are coming from the bacillar artery. So we can see that this bacillar artery, it gives branches to the anterior inferior cerebral artery, labyrinthine artery, pontine branches, superior cerebral artery, and posterior cerebral artery. Now, so this is the vertebrobacillar system. On top of this is the carotid system. So carotid system comes here, internal carotid artery, and we have the posterior communicating branch. This posterior communicating branch, this is connecting vertebrobacillar system and the carotid system together. So as we move on into the carotid system, we have this middle cerebral artery and also anterior cerebral artery. So as I said, like it is like a duplicate. Whatever is here, the same thing is also there. So they are connected with this anterior communicating artery. So now we can see we have the circle of Willis. A circle of Willis is formed.